Well, earlier this morning, the U.S. Supreme Court handed down its second big decision of the week. They have upheld President Barack Obama's health care initiative. Now, so what does this mean to you, to your family, more importantly, to your pocketbook? We have several medical experts on our panel this morning, and we want to get right to it. I'm joined by Dr. Mark Hong. You are to my right. Also, Ms. Kim Van Pelt, Director of Arizona Health Futures for St. Luke's Health Initiatives. Thank you very much for both joining us. First off, what are your thoughts on the decision this morning?
Well, I think the Supreme Court decision gives Arizonans an opportunity to move forward on a lot of the issues that they care about. It certainly provides opportunities to address issues on access to care and affordable health coverage, whether people can get health insurance or not if they have a pre-existing condition. It certainly was an opportunity for Arizonans to move forward on issues that we care about at a local level.
Now, initially, the whole purpose of this law, and I think everybody agreed, that the healthcare system is somewhat broken. And the idea was to get more people to buy into the pool of health insurance so that the premiums go down. Mm-hmm. Is that going to happen, Dr. Holmes?
Well, you know, first of all, Javier, this was actually kind of a shocker for most of us in healthcare. We were all expecting the individual mandate or that mandate to buy health insurance to go down. And so when we got this, I think all of us were a little bit in shock. But the truth is, you know, nothing really changes because we've had this law for 2 years. And also in one fell swoop, everything changes. It's kind of like in the words of one of my colleagues, Dr. Al Borhan, it's like when you have the pop quiz and you didn't really think you had to study for it, but now all of a sudden you have to take the test. Mm-hmm. It's kind of like that. Now we actually have to pay attention to what's in the bill.
And that being said, you coming from St. Luke's and seeing that people without insurance, I'm sure, flooding your emergency rooms, what changes for them?
Well, what happens really is the health reform law primarily kicks in 2014. And at that time period, there will be things called a health insurance exchange where people can purchase health insurance with federal subsidies. There'll be a requirement to buy health insurance at an individual level. There will also be an expansion of Medicaid, our access program in Arizona, although my understanding is there's some limitations on that expansion or that requirement to expand Medicaid in the decision. What that means is we have 1 in 5 Arizonans that lack health insurance right now, and so it's really going to dramatically change that over time.
Doctor, and I don't know if you have the answer, but a lot of this stuff, some people agreed on. 26 years old, you can stay on your parents' health insurance program. Also, pre-existing conditions. But at the end of the day, forcing people to buy health insurance, does this help your practice?
Well, this is interesting because, as you say, you know, most people were opposed to the law, but most people actually liked what's in the law. It's kind of a paradox. And I think ultimately for the care of Arizonans, we're going to basically have a lot more people who are insured. This is a good thing for everybody in the sense of we already pay for the uninsured. It's just that they show up in the ER where the cost of paying for that care is 9 times higher. This will actually put a little bit more focus on preventive care, where it's a lot cheaper. It's a lot easier to change the oil in your car than to change out the engine. So these are the things that it actually can help the health overall, and of course then help us provide better health care.
So the people out there in the public looking at this, and of course they're looking at their bank accounts and saying, can I afford health insurance? Will this help them afford health insurance?
You know, at the end of the day, we all pay for our health care one way or another. What I think the Affordable Care Act is trying to do is trying to make the costs paid for in a way that makes sense. So they're trying to drive down the overall cost of health care by making it more efficient, trying to make sure people get preventive care as opposed to going to an emergency room to get their care when they're uninsured. So overall, the system costs will hopefully go down over time. But, you know, at the end of the day, a federal law is not going to be the cure-all. We really have to take action at a local level to make sure people get early preventive care, lead healthier lives. These are the things that ultimately are going to bend the cost curve.
All right. Well, we thank you very much for your input. And of course, there's a lot more to be said about this because I just showed you this is the decision here. So a lot of interesting tidbits that we have to get to and read moving forward. Thank you very much.
Thank you.
Thank you.